Hi, I'm Charlotte Croteau, and I'm one of the senior residents at the NYU Bellevue Emergency Medicine Residency. Today, we will learn how to place an ultrasound-guided IV. This is an essential skill throughout the hospital, particularly when you need to obtain IV access in a critical patient. When done properly, this should be an easy and fast procedure. This module is designed for learners that are already familiar with peripheral IV placement. If you need to review that content, please see the attached resources. Let's get started. So now let's gather our materials. We will start with non-sterile gloves, a chuck in case of bleeding, sterile lubricant, ChloraPrep to clean the patient and the probe, IVs. You should use a 20 or an 18 gauge, and the needle should be a long needle. Always grab multiple needles in case you need multiple attempts. We'll grab our IV tubing, a saline flush, an adhesive dressing, gauze in case of bleeding, our tourniquet, and of course, the ultrasound with a linear probe connected.
Hi, I'm Jalen, another senior resident, and we'll go over the ultrasound itself. For procedures, we're going to use the linear probe. This one has a marker on the side of it. This is going to correspond with a marker on the side of the screen. For orientation, make sure that the marker is on the same side. So if it's on the left side of the screen, it should also be on your left as well. The top of the screen is going to correspond to the surface of the patient, and the deeper you are or the more down it is going to be deeper structures. On the side of the ultrasound is a ruler. This generally gives you a sense of how deep the structures are, 1 centimeter, 2 centimeter, 3 centimeters. Finally, for procedures, a lot of people like to use a midline marker. For a lot of machines, this is going to be M mode, which basically signifies where this middle dot is on our probe. In our machines in particular, we actually have a centerline function, which is a little thinner and easier to use. Now let's take a look at some examples of some veins.
We have placed the tourniquet in the most proximal position possible on the patient's upper extremity. Now I will take my linear probe and look for either the cephalic, basilic, or brachial vein. The basilic vein is my personal preference, as this is often very easy to identify regardless of habitus and is isolated from nerves and arteries. Let's begin finding our vein. I am going to travel with the linear probe proximally and then again distally to visualize the vein in its entirety. I'm going to confirm that the vein is not an artery by compressing the vein and seeing that the vein is compressible and also not pulsatile. Now I'm going to find the best area to insert my needle. I want to find the vein when it is the most superficial and the most visible. I'm going to insert my needle here. Now we are ready to insert our needle. We are going to clean the skin with ChloraPrep or some other skin antiseptic. I will then use the same ChloraPrep to clean off my probe. This is a clean but not sterile procedure. Now I am ready to insert my needle. I'm going to take my sterile lube at this point and place the lube on the skin over where I think I would like to go. I'm going to hold my probe in my non-dominant hand and I'm going to find my view again. Now I'm going to insert my needle at a 45-degree angle from the skin. I'm lining the tip of my needle up with the marking on the center of the ultrasound. I am puncturing the skin. There is a bright white dot on the screen. I want this bright white dot to be in the center of the vein. I'm going to advance my needle until I have that view. Now that I have that view, I know that I'm in the vessel. I'm going to advance my probe proximally until I lose that view. Now I'm going to advance my IV until I gain the same view with the bright white dot in the center of the vein. I'm going to do this 3 times to ensure that I'm truly in the center of the lumen. You can see the bright white dot enters the vessel every time. So I'm confirming that I'm truly in the vein and that I am not seeing a trick of the eye. Now that I'm confident I'm in the center of the vein, I am going to thread my catheter. I'm going to occlude proximally and remove my needle. Now I'm going to attach my tubing. I will remove my tourniquet. And now I'm going to confirm that I have backflow. This is a good check to ensure that you are truly in the lumen. You can see backflow into the tubing. So now I'm going to flush my IV. This should flush very easily, which it does in this case. I'm going to grab the gauze. Now I'm going to clean off the extra lube so that my skin is clean and dry. Now I will apply my sterile dressing to secure the IV in place.
As far as troubleshooting, here are some important tips. One is to always use the probe and move it to confirm the tip of the needle. For example, I see a white needle in my field right now, and if I move my ultrasound probe down this way, it disappears. That's how I know that it's my needle tip and not in the center of the needle. So look at this, for example. If I just look at this isolated view, it looks like my needle has not hit the vessel yet. However, if I look at it longitudinally, in reality, my needle's already in the vessel. And if I were to advance, I would actually go out of the vessel. So here you can see I'm moving my probe down while keeping my needle still. And I'm waiting to see the end of it to confirm, again, the tip. Sometimes if patients are moving or the anatomy doesn't look quite right, we might get our needle in and not be quite in line with our vessel. As you can see here, my needle is quite a bit to the right side of it. So I'm just gonna advance my ultrasound probe until it disappears so I know that is my needle tip. I'm gonna redirect my hand pointing leftward because my needle is too right. Advance the needle again, advance my probe, advance the needle, advance my probe, advance my needle, and there I am. Now I'm back in the vessel, and I'll continue to advance it right in the center of the vessel. And again, if you're to left, you would just angle to the right.
That concludes our tutorial. Now let's review all of the steps necessary to master this procedure. Identify you are performing the procedure on the correct patient. Gather all supplies, including backup needles. Ensure adequate power supply for ultrasound machine. Wash your hands, then put on your gloves. Position the patient's extremity appropriately. Apply the tourniquet. Identify your target vein with the ultrasound. Confirm that the vein is not an artery. Thoroughly clean the patient's skin with ChloroPrep. Clean your probe. Apply a small amount of sterile lubricant to the skin. Find the vein with ultrasound again and turn on your midline indicator. Insert the needle into the skin between 30 and 45 degrees. Advance the needle until the tip is in the center of the vein. Decrease the angle of insertion and continue to advance the needle under ultrasound guidance until the majority of the needle is within the vein or hubbed, keeping the needle tip in the center of the vein. Thread the catheter and retract the needle. Attach your tubing. Confirm backflow and flush your tubing. Remove the tourniquet. Secure the IV and the tubing. Now it's time for you to practice placing ultrasound-guided IVs. Keep in mind that every patient has different anatomy, and it will take time to become truly proficient. Follow these steps, and you will become an expert at placing ultrasound-guided IVs in critical patients with difficult access.